Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health.
Today I'll be speaking with Tiffany Calvetti, Practice Manager for Dr. Carol Fischer's office in Cheyenne, Wyoming. Welcome, Tiffany. I'm so happy you could join me today. I'm excited to showcase your work in one of our partner spotlights. It's been quite a while that we've been working together, and you started with a self-monitoring blood pressure program that has finally transitioned into RPM. So I would love for you to describe your remote physiological monitoring success and what it's taken for you to get there.
Well, the approach of this actually started 5 years ago, so that's how long we've been in this relationship. Being in rural Wyoming, we were seeing an increase in hypertensive patients. According to the state of Wyoming, the leading cause of death in the state was heart disease. Our goal was to stabilize the numbers of our hypertensive patients, or to help those patients improve their quality of life with knowledge and support from our practice. Some of the changes that we were able to get results with are education to the patients on their chronic illnesses, changing their lifestyle choices, and just all of us being proactive. But we found we were not able to move quick enough to keep some of them from the emergency department or even a hospital visit.
How would you describe your goal of your initiative?
Our goal is healthier patients all the way around, making sure that everybody is on board with the same care plans. It's been a long process. I think the biggest problem I had was the buy-in from our staff for work that they were already doing. Then COVID hit, took over all of our workflow. The patients weren't wanting to come in. Everyone was struggling with the workflow to get the information from the patients to the charts, getting them reviewed, and getting the patients their appointments to have their discussions to make their changes that needed to take place. We did incorporate at that time several Bluetooth blood pressure cuffs into our workflow. They were a loaner program. Working with our EHR and the patients once again became frustrating. The patient needed to have access to their portal. They had to have access to their blood pressure cuff account. They had to link the two of them together. And a lot of our patients just were technically challenged to be able to do that. We did get several that did get through, and it would dump the information right to the chart. It would alert the staff that there were readings that needed to be reviewed. They'd go ahead and review those readings and reach out to the patient. What we noticed with the patients were following the requests of the documentation 2 times a day, that their blood pressures, but they weren't reporting them to us until their next office visit, which could be up to 2 months down the road. So they bring their documentation in at their next visit and just tell us that their high readings were just situational readings and not that important. So we kept moving forward with this. There was no way to be able to access their readings in a more prompt manner. So that time is when we decided to pull in a remote physiological monitoring program where our patients are able to their readings are read instantly. And if there's any critical alerts, we're alerted right away with those, and we're able to reach out to those patients. Just since we started this program in February, we have 329 patients enrolled in our RPM program. We have 32 of them enrolled in our self-monitoring program, and everybody's buying in and understanding that we are able to help these patients, first of all, stay out of the hospital, the emergency department, and just level out their lives and feel and are a lot healthier. Just in the last 2 weeks alone, we have been able to prevent 4 of our patients from presenting to the emergency department.
That's amazing. So there were a lot of hurdles. There was a lot of challenges that you faced. And so being really tenacious and resilient and not giving it up because you were focused on the goal of improving the health and well-being of your patients in your community. I think that's wonderful. If there were other people who have been struggling with loaner programs or with the decision to do remote physiological monitoring, what advice would you have for them?
The big one, make sure you've got big pockets and put your patients in them and pack them along with you every day. It just goes to show after 5 years of working on this, making the changes, listening to the staff, listening to the patients, I feel like we are definitely in a forward motion with this program, with this initiative to make sure that our patients are getting the best of care that we can give them in as rural Wyoming.
So you did get some support from the Wyoming Department of Health Chronic Disease Prevention Program. Do you want to tell us a little bit about how that helped and how that incentivized you?
Just having that back support of listening to people that have been working with other people, listening to the problems, being able to bounce ideas off of all of that has been huge for us to be able to move forward with all of this plan.
Well, you've definitely been one of our long-term wonderful partners to work with, and I congratulate you on getting to the point where you're at. Your numbers are amazing, and I'm sure your patients are realizing the benefit of all of this technology and support as well. But again, you focus on the patient, and the patient outcomes are what matters in your clinic as well as within your community. Thank you so much for your time today. I appreciate it, and I look forward to our opportunities to work more together as we move forward. Thank you, Tiffany.
Thanks, Deb. I appreciate your support as well.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.